Welcome to the Oral Systemic Connections Podcast. I'm your host, Dr. Tom Larkin, here to explore how your oral health connects to your overall well-being. From heart disease to diabetes, your mouth is the gateway to your body. Let's dive in. Welcome to Oral Systemic Connections. I'm so excited this week. I am going to introduce you to a true visionary. Without further ado, I am introducing Deirdre Detraz, nurse practitioner extraordinaire from Lafayette, Louisiana. I pulled her off of Bourbon Street. She's at Mardi Gras. She's probably in the midst of some celebration, but I said, come on, girl, let's do a podcast. And there you are.
Absolutely. Thank you, Tom, for having me. Absolutely.
So let me tell you a little something about location. Okay, you're in Lafayette, Louisiana. Okay. There's an old saying in Kentucky in the horse business: where does a great racehorse come from? Now, you would think the most logical answer is Kentucky. The answer is anywhere, right? I find the most amazing healthcare practitioners in the most amazing places on earth. I have a group that I coached in Shreveport Dental Solutions, Ben Kakos. This is a couple of years ago. He absolutely transformed. He's got 5 hygienists, transformed his dental practice to not so much talking about periodontal disease, but oral systemic, right? So, and then my clinical career was in Arkansas. You know, these are humble areas, right? With a lot of healthcare challenges. So I want people to know, as I introduce, a variety of people over time, this is not location dependent. I mean, I've had coaching clients in Manhattan, Beverly Hills. This is not about a location, and being able to do something extraordinary. So the title of this podcast is Visionary. I consider you a visionary. Okay, that's the word that I've chosen for you, because what you've done, which a lot of people may not know, but they're going to know after today, is that from a time standpoint, you decided to create a path where there wasn't a path. Okay, I've done a lot of startup consulting and acquisition consulting. And to be honest, it's kind of templatized. I mean, you find a space, you lease a space, you build a space, there's only so many things. You created your own path. So here's where I want to get started. This is where I always like to get started. I want to talk to you maybe like high school time, age, or whatever, teenage years. It's that awkward period where we all are trying to figure out what the heck are we going to do with our lives, right? So you have a tremendous heart for people and for caring for people. And I know that there is someone who had an influence in your life around that time or even before then. So who was that person or persons?
Oh, that's a great question. So a lot of this is shaped by educators from high school. Particularly love my chemistry teacher, Miss Christine. She played a massive influence on just my love for chemistry and for science. It happened to be a subject that kind of came naturally to me, but really delving into biology and the chemistry aspect of this. Very interestingly, up until I was probably a junior in high school, I really had a desire to be more in the marine biology space, just because I really enjoyed water and water sports and just marine animals in general. But then as you get to your later high school and really trying to understand kind of where can you work, what kind of career can you be in, it really kind of shifted to more in the nursing, almost anesthesia space. So I kind of ran with that path thinking, or nursing school and then go on and get a master's to go into anesthesia. But once I had finished my RN degree at Northwestern State University in Natchitoches, I moved out to Dallas and was fortunate enough to do a critical care residency through Parkland, which is the only level 1 trauma center there at the time. So getting an opportunity to work in critical care, which was the path at the time to go into anesthesia school, I realized I really enjoyed taking care of awake patients and really kind of pivoted away from anesthesia, and then was almost a little bit at a loss about what I wanted to do, because I knew I wanted to further my education, at least with a master's degree or beyond. And the opportunities were either anesthesia, education, administration, or these 2 clinical paths, which were the clinical nurse specialist and the nurse practitioner. And this was this was back in 2000. So not really well known as a profession, particularly in Louisiana at that point.
Right.
So after looking at the clinical paths of clinical nurse specialist and a nurse practitioner, there was quite a bit of overlap, but the nurse practitioner route was almost by default, which is quite interesting because I feel like nothing is coincidental. It was clearly a divine appointment, because of the autonomy in the nurse practitioner role is really what sold me. So that's what really shifted me in. I didn't have a real desire to just do nursing in particular, but there's always a reason.
So the critical care part was kind of foundational to you, right? And then you made a pivot into interventional cardiology, right? I mean, your resume is just stacked. I mean, you have so much incredible, it brings you to where you are today. So talk a little bit about that, okay? Because obviously cardiology is really kind of foundational to what you and I are doing, right? So talk about that.
Okay, yeah. So I did again my training around the Dallas, Texas area, and then moved back home to South Louisiana, knowing that I wanted to be around family again and felt like I could make an impact. Because we have so much heart disease here in South Louisiana. So my first nurse practitioner role jumped right into traditional interventional cardiology. And I did that for probably 6, almost into 7 years.
Wow.
So in the last couple of years that I was with that particular cardiology office, I had a very unique opportunity to run a prevention center for that group of cardiologists, which really lit me on fire about prevention and early detection and kind of looking through different methods, how to go about doing that.
Okay. I was curious because that was kind of my next question is obviously there's a pivot, right? When you go from reactional care to proactive care, it's usually a light bulb moment for most people that I know that are, super into this. It's usually that kind of a thing. So it was actually within the conventional space and this prevention thing kind of opened up and you were pulled to it because it made sense, right? The thing about reactive care, and I hate to say this, but it happens on the medical side and the dental side. Reactive care gets very overwhelming and it's just disease. You know what I'm saying? And it's hard to stay motivated because you're overwhelmed with the amount of the disease. Our system is just set up to react to problems, whether it's with a prescription or whatever. And it's high volume. It's just, what's your symptom? And here's your medicine, right? It's not root cause. We don't stop to look at it. So this whole movement. So you when did Baledoneen get on your radar? Because that was your big shift, right?
That's absolutely right. So even in the conventional space where I was and running a prevention center for them, the first education component of this for me was when I had the opportunity to get trained at the University of Minnesota's Rasmussen Center.
Okay.
They were very cutting edge in terms of a preventative protocol under the direction of Dr. J. Cohn. So I got to go up there and study with him and his nurse practitioner, Lynn Hoke. And that's really kind of what started it. So kind of learning their particular protocol and then coming back to Lafayette and really mimicking that. But then I knew that I really didn't have any other colleagues who were prevention specialists in that space. So I took it amongst myself to really start seeking out opportunities for further conferences, whether that was a cardiometabolic focus, further prevention. So really at that point is how I stumbled across the Baledoneen preceptorship.
Okay.
And you're right, that took it to a whole nother level for me. And then realizing after going to, getting associated with the American Society of Preventive Cardiology, going through this particular conference in Boston, the Cardiometabolic Health Congress, all of these things really taught me that I really needed to take ownership over the prevention space over here. And not being limited by the fact that I'm a nurse practitioner to still be, a prescribing provider to be able to deliver this kind of care and to be a resource to my other colleagues in this area. So yes, Baledoneen, that preceptorship happened in Washington. I think that was actually in Seattle. So that was probably, I'm going to say around 2010.
Oh, okay. Wow. You were so early. So I probably met you a few years after that at a Baledoneen conference. We saw each other a few times there. Wow, you were so early. So this is what I need my audience to understand. Okay, you're assembling these pieces parts, and at the time, so I happen to look up right now, nurse practitioner independent practice, 27 states now. I would imagine in 2010 there weren't 27 states. I mean, I would imagine it was much smaller. Okay, so you say to yourself, all right, I'm going to put my stake in the ground, and I'm going to create Apex. I love the name. I love that brand, and you. This is your creation. You're the boss. You're taking all of these things. You're just a voracious learner, and you come out, and it's just so courageous. Okay, because you have to understand when you're the first person to do something, somewhere in the back of your mind you had to say to yourself, is anybody going to come, or what do I do if no one comes? Right? Did that ever cross your mind, or are you just so confident that you just said, what they say was, build it and they will come, right?
Right. Well, luckily, again, worked with the opportunity to run the prevention center with a group of cardiologists that I had for a couple of years. That really took out any real concern of whether or if patients were even interested in this style of a care.
Right.
So I kind of had an opportunity to employ that a little bit.
Okay.
Then as I would continue to go to these prevention conferences and realize that prevention really, really was continuing to evolve. Some things when we started this program were kind of falling out of favor. New things were coming on board. So ultimately, again, just to not be in a corporate kind of setting, I knew that was going to allow me to immediately implement any kind of new technology, lab work, diagnostic testing, as I would learn it really in real time. If I learned something over the weekend on Monday, being in my own space, I could implement it immediately and not have to.
What if your role as a dental professional could go far beyond teeth? What if you weren't just treating mouths, but saving lives? Preventive dental care is evolving rapidly. The oral microbiome, salivary diagnostics, lasers, biofilm therapy, they aren't just tools. They are the future of healthcare. They're turning hygienists and dentists into leaders in disease prevention and whole body wellness. The question is, will you lead this change or be left behind? This is your moment. My name is Dr. Tom Larkin, and as a founder of Proactive Oral Wellness, my mission is simple: to equip you with the tools and processes to transform your practice and your patients' lives. That's why I'm inviting you to join me and some of the nation's leading experts in Lexington, Kentucky on April 26th for the Future of Dental Hygiene 5, The Blueprint. We will unpack the framework of the wellness-centered practice, new patient onboarding from a variety of really unique practitioners, specific preventive protocols, medical dental collaborative communication platforms, AI and prevention, and the revolutionary products that are bringing so much hope to this movement. And my podcast listeners get an exclusive offer by entering promo code POW. That stands for Proactive Oral Wellness. Every event that I've held so far has sold out over a month in advance. So reserve your spot early at oralsystemicmastery.com. Hope to see you there.
Yeah, you just absolutely hit
command or just bureaucracy.
You hit the nail on the head. The autonomy to go learn something and come back and implementing without having to go to committee and to go through some bureaucracy and say, hey, we need to look at this, right? That capability to do that, that's the benefit of taking the risk that you took, right? Because you're smart enough and you're well read enough that you know how to do this. So Apex Prevention 2012, is that when that came about?
That's when that came about, 2012. So I had the opportunity to get introduced to the Baledoneen method, which again just kept feeding my soul as I was learning different prevention protocols, and really was just not in a position to implement it under the umbrella where I was prior. So I knew that I always like to talk about a particular quote by Maya Angelou. She says that do the best you can with what you know, and then when you know better, do better. So as I was continuing to learn new and better techniques, but being a little limited in being able to implement them all was ultimately the goal, or the almost the final straw that said, okay, I need to step away and really, really do this independently. So I can continue to grow and evolve as the technology and, and information, our knowledge base was just growing exponentially, in my opinion, at that point. So in 2012, I took the leap of faith and said, okay, people knew me in my area as the prevention person. So kind of stepping out, and as with everything, it was a little slow to come, but eventually, it was, and still to this day, it's really word of mouth. There's never really been any marketing or big advertising push, or because being a solo provider, I really needed it to really be slow, controlled growth.
Right.
And we've done that quite successfully up until pretty recently here, that I finally got to a point here at the end of 2024 where I was ready and willing to bring on another practitioner and actually get them educated, because I was really at that point, I could not see any more patients by myself, so it was time to bring on another nurse practitioner and really groom them to be, the next prevention specialist.
Right. That's so awesome. So my attraction to the Baledoneen method were twofold. Number one, I shouldn't use the word simple, but it's a very straightforward methodology, right? You have these root causes of inflammation, and you come in there like a practitioner, and you do labs and measurements, and you just attack each one of those root causes, right? And then the underlying, guarantee that some Baledoneen practitioners have is that, if your cardiovascular risk, if all of these factors are under control, it's just negligible, right? And it was just brilliant. I'm looking forward. I'm having Dr. Bale on a podcast here. He's on my list. I communicated with him, and he's coming to Lexington in April, as you are too. And I'm looking forward to getting with him, because there's so many of us that owe a debt of gratitude to him. We just really do. Him and Amy, right? To create this. So, some of the questions I'm going to ask him is, how in the world did you come up with this? This incredible approach. So one of the things that I know in your model, because this method has been used in it's used a lot in concierge medicine, executive medicine, and then we talk about access to care. And the great thing about, being your own boss is that you can implement this in any way you want, and access to care happens to kind of fit your heart. It's that you want people, because why would we not, if it's not cost prohibitive and we can make this affordable, why would we not take the time to educate people that there is another way? Now, one of the reasons right now, while you are mega busy and I'm mega busy, is that for the first time in a very long time, prevention is now front and center, because of some political stuff, and that's not really important, other than the fact that you and I both know that our healthcare system is badly broken, and it's unsustainable. It is not sustainable financially. So if there's not people like you creating models, or me trying to educate dentists on how they can fit into this model, there's going to be a super bad outcome. It's a dollar and cents thing, right? And so talk a little bit about how over time, and like I said, you're a 13-year overnight success. Okay. That's the best way to describe you. You've spent a lot of sleepless nights, like all of us who are entrepreneurs and who are creators and visionaries. So talk to me a little bit about access to care and how you have addressed that.
Right. So whenever I opened up Apex Prevention and really stepped out on my own, it was really done under a traditional insurance model.
Okay.
Patients would have insurance, private insurance. They would be private pay. They would be Medicare, Medicaid. Come into the office. We would do lab work, just very traditional. We would submit office visits through their insurance. But really, with the limiting factor to do this kind of medicine that we're all doing, is that it takes time. The education component of this, I have really not found a successful way to really cut the corners in terms of literally sitting down with the patient one-on-one in front of you and just explaining how and where plaque develops, and really explaining the whole root cause thing. that for the first probably 6 or almost 7 years of the whole Apex prevention model, we were seeing patients spending about an hour of time per patient. So you can imagine that limiting your day to about 8 to 10 people at best. So that still is the ultimate challenge, because this can't be done per one provider to see 30 and 40 and 50 patients a day like the model is set up. There just simply is not enough time in the current model to deliver this degree of education for them. So I think it was 2018. This has been 6, almost 7 years now, that again, I was spending probably 70 and 80 hours a week trying to see patients, had built up a clientele of almost 2,000 active patient charts as a one-man army. And I was just drowning. I just could not go anymore. So at that point, then we really started looking, because I'm almost certain that at that point I was probably one of only a handful of true prevention providers, particularly colleagues of the Baledoneen method, that was really trying to deliver this kind of care on an insurance-only based model.
Right.
And I'm here to say that I've done it for a really, really long time, and that's not sustainable for you as a provider.
Correct.
So in 2018, we developed a bit of a hybrid model where it was a bit membership based, but I knew what some colleagues, were charging, which is rightfully so. It's not to disrespect anything in terms of their price point, but we knew that once you got above a certain price point, that was only going to be accessible to a certain percentage of people. We kind of call them the 1%ers. So we can't make a vast shift and a real change of this unfortunate epidemic by dealing with such small percentages. So we tried to come up with a price point that was going to be accessible to the large majority of people, but still have them be able to still continue to get the same level of care and the same time component as well. So that's where I feel like Apex Prevention really, really kind of shined and took off from a success standpoint, is that it made it continue to be extremely beneficial for the patients that come in our care, but also establish some work-life balance to make this model sustainable for the provider.
Yeah, exactly. Yeah, you can't run yourself into the ground physically. As much as you care about the whole process, that work-life balance is important. So, yeah, and once again, you have figured it all out. And one of the things that's happened, and you've probably noticed this over time, is patients know that our healthcare system is kind of jacked up, and so they're looking for self-empowered solutions. They're really out there looking. They use Dr. Google, unfortunately, and other things, but they're looking for people to help them, right? Because our system is so expensive, and it's just so broken. And when we talk about proof of concept, we talked about that last week. There's no proof of concept. You have a 13-year track record. I don't know how long Dr. Bales is, but I'll find out how long. Is it 20 years or whatever? There's no proof of concept. This is a statistically phenomenal approach from both a statistical and a financial impact. The problem is, a lot of people like yourself and Dr. Bale and other people, we're practicing in silos. We're kind of independent, whatever. And so what I'm trying to do, because I sense a change in the wind, that if we are going to take a serious shot at changing our healthcare system, and there's some of these task force that are being formed as we speak, people like yourself, people like me, need to step forward and put our hands up and say, hey, you may not know who I am, but I'm doing something cool and proof of concept and blah, blah, blah. So I don't think these solutions are, and once again, not being disrespectful, I don't think they're necessarily going to come out of the universities, right? They're going to come out of people like yourself, visionaries who, boom, 13 years ago said, I need to go create my version of what this means. And I need to explore and learn and see what impact I can have on this population of patients. And you've done it. And, and you're not the only one. I mean, there's there's numerous people who have followed the Baledoneen method to a T and have similar results, and so if a person was going to ask me, kind of what makes you tick and what makes me tick is that I'm in, knock on wood, I'm enjoying the benefits of some of the best health in my life right now at this advanced age, right? And I look at high school reunions, college reunions, and go, geez, everyone's on a CPAP except me. Everyone's, and you look around, as you get older, it gets real, right? So one of the things that I saw, and I told you I went to that A4M convention, and it really, it was good for me on a lot of, and I get on their mailing list, and I was looking at one of their email came out and was talking about, Health and Human Services. They're looking for, there's going to be a series of things that they're looking for. And so one of their first initiatives was early detection, and early detection is just absolute key. Well, this is exactly what you're doing. This is exactly what I'm teaching dentists. But it talked about, and these terms are super familiar to you, and I know you use them with patients, health span versus lifespan. Who gives a crap what your lifespan is if the last 10 years are horrible? Okay. If you're completely disabled, forget that, right? The operative word is health span. Okay. And so taking preventive measures, and there was a study done, and there are people that are bean counters, and they do all these statistics, and they know, but they were talking about the compression of that period, and the words that they used were disability and fragility. Okay. I hadn't really heard that before, but if we can compress that time frame at the end of life, because as you know, the cost expenditures at end of life are astronomical. The last whatever happens, it's in the hundreds. It's just a screwed up system, hundreds of thousands of dollars, and then you die. All right. And it's like, how does that work? Okay. You deplete all your assets in the last, and it hurts your family. It hurts everybody. Right. And this is what you're doing is the freaking answer. It's the answer. And it gets me up every morning. I put something, I was jokingly telling my wife, I said, I don't have a title. I'm not a title guy, but I came up with a title. I said, I'm the preventive dentistry evangelist. Okay. She said, I don't know if I like that word. I said, what else? I said, what else is there? What else is there than for you? You're an evangelist. This is in your soul. This is not a job for you. You're not doing this for money. Okay. That's never crossed your mind. I mean, it's a business. We all need to make a living, right? But we need to be evangelists, because for whatever reason, and in some of my courses, I always use Charles Mayo, who founded the Mayo Clinic in 1915. I always use him as an example, because in 1915, he made a lot of really, really great statements about prevention, especially about dentistry. And he was pleading with the dentists at the time to get involved in the founding of the Mayo Clinic, because he said the next great movement in prevention will be made by the dentists. And they just all ignored him, and so to a varying degree, dentists have never really gotten engaged in this conversation. Well, now, because of the Baledoneen method, it's required. And that was the light bulb moment for me. So when I first became a patient of Brad's and I went to Nashville, he goes, I need a CT scan, I need a periopathogen saliva test, and a sleep screen. And I was like, required, right? Because you can't complete your workup. So what separates you from a functional dentist, and one of the things I'm doing now, I may have told you, is I'm getting on some functional medicine podcasts, because I want to teach them. If they practice in complete isolation of a dentist, they are going to have, and you've already experienced this, you're going to find somebody with some markers, and you're going to get stuck. Because if you don't look in the mouth, and it's not a huge percentage of the case, but it happens, right? You'll get a myeloperoxidase or whatever, and then you're stuck. Well, guess what? Brad and Amy figured out, hey, just take a look in the mouth, abscess tooth, root canal, blah, blah, blah. Take the tooth out, resolution, right? I thought that was genius, and that's the opportunity. So you're ahead of 95% of the functional medicine guys.
No, you're right. This is how you and I got so connected is, you can't deny the oral systemic connection and where I really had an opportunity to realize, because, when you're, I call it stuck in my cave, when I am in my room all day long, taking care of patients, it's hard to really kind of see from a bird's eye view what's really going on, how people are hearing about you, and really what that perception is. And when I started having dentists drive in from 3 and 4 hours away to come see me at my office, that really was a light bulb moment for me, where it did take pause and say, oh my goodness, okay, this is real, this is big, and this is not going anywhere. I said, because how humbling to have all these brilliant professionals. I said, do you understand how many physician offices they have to pass to come see me? Nobody else in terms of their local colleague perhaps appreciated the oral systemic connection. So I significantly value not only my patients that are in the dentistry space, but my colleagues, as well, regionally.
You've embraced it.
And I've even had that.
Yeah, no, that's what makes you special. You're just such an exemplary human being, and I'm just so honored to meet the people that I meet. Prevention-oriented people they're very purpose-driven people, right? And somehow they find me, and my job is I'm just kind of a connector, if that makes any sense, where I can bring people together and we can have conferences and meetings, and I'm reasonably smart, but I don't know everything. And I just said, I got a lot of smart people around me, and and it's just and I learn something new every day, which I love because it keeps me vigorous and keeps me challenged, right? And I think that's important in life. So any other, did I miss anything, or is there anything that you want to talk about or cover that I may have missed?
I think it's really just starting the conversation. I appreciate people who do these podcasts because, as you mentioned, and I just want to kind of go off a little bit of what you had mentioned earlier about the healthcare system really being just so broken and how it was really designed to be reactive and to handle acute medicine, but we are substantially failing from a chronic disease standpoint. And unfortunately, I think that it's going to come from a grassroots effort, I think, by way of educating the public, by way of your podcast. There's several thought leaders, in that functional medicine space, even in some traditional medicine space, that are just really trying to get away from guideline or, standard of care driven medicine. There's probably nothing that really kind of gets under my skin is when people talk about guidelines, where the guidelines tell us, we need to do this, when we're losing focus that the guidelines are just that. They are guidelines. That's not like carved in stone. That's a suggestion about where you should at least start. Standard of care, it's almost, in my opinion, that's like a C average. It's almost the bare minimum that you have to do to somebody to avoid litigation. By no means does that say is that the end all be all, and that's clearly not personalized at all. So again, unfortunately, a lot of our colleagues in the primary care space sometimes have we get negative feedback because they say this is not evidence-based. But the reality is just because it's not in the guidelines or not part of the standard of care does not mean that this is not evidence-based. Right. If you look at Brad and Amy's book, Beat the Heart Attack Gene, it looks like the entire last chapter is resources written like a thesis. There is nothing about this that is voodoo medicine or, no. The science is there. It's just going to take the guidelines and standard of care probably a few decades to catch up for what we've already been doing for the last decade or two, at this point. Yeah. So I appreciate you and really educating the public, because that's what they want. They want something different than what they've heard year after year after year at their wellness visit, which, as we all know, that lab work is extremely superficial, like you mentioned. And I say all the time, I'm not the smartest person out there. I said, but what I do have is a great tools. We have blood work, we have CIMT measurements, we have something that's going to delve very deeply inside your body and tell me. That's all I said. I said, I just kind of read what your blood work is telling me. It's going to tell me what you need more of, what do you need less of. And if we just comply, the body wants to fix itself. Sometimes we just have to create the right environment to allow it to do that. And of course, that's going to be lifestyle driven, but that's really our foundation. But oftentimes we need to build off of that in terms of whether that's supplements, whether that's medical management. There's a place for all of it. And I think if we're one-sided or the other in terms of Eastern versus Western medicine, we do our clients a disservice, So I think if you put the right blend of that together, then people do exceptionally well.
Yeah. I love your comment there about, lifestyle. And it's kind of so I try to take a centrist position on most things, because especially with the evolution of the past 2 or 3 years of podcasts and TikTok and stuff, you see some healthcare practitioners, and there tends to be extreme views get attention, right? For example, fluoride causes breast cancer. Oh my God, 1 million views. It's like, no, we don't need to go there. Okay. It doesn't serve. What I just say, it doesn't serve me. Okay. It doesn't serve me if I start getting way out there, and that's always going to exist. Okay. But it was like you said, this is such a sensible approach that covers everything. It's lifestyle, it's supplements. It may be some prescription medications that are, that help in the balancing of everything. And I think that's the sweet spot. And I think that's the sweet spot that you have found. And I think that's an important message that you just said, because there's a tendency right now, and and I scan some social media just because I kind of want to know what people are thinking and doing, and it gets out there. So I want to be the centrist guy, right? I want to keep everybody within the guardrails, and this isn't voodoo medicine. This is proof of concept, right? Proof of concept. Well, it's an honor to have you as a friend. It's an honor as a colleague, and I really look forward to. There's some big things happening. I kind of feel like it's an earthquake kind of rumbling underneath me every day now, and we're going to be doing kind of some more things in the future, I have a feeling. So thank you for your time, and I'm going to let you get back to the best week in all of New Orleans.
Well, thank you so much, Tom. It's a pleasure, as you said, to not only be a friend, but a colleague, and anything we can do to change the world for the better, I'm in your toolbox. I'm here to help.
And that's a wrap on today's episode of Oral Systemic Connections podcast, where we prove every week that your smile is way more powerful than you ever imagined. If you enjoyed this episode, hit that subscribe button, share it with someone who deserves to know these jaw-dropping truths, and leave us a review to help us spread the word. And remember, every smile you care for is an investment in your whole body health. Keep smiling, keep thriving, and I'll see you next time.